Check out the latest highlights from the Nourishing You podcast. Can you talk to us a little bit about how heart disease starts? I think there are many people that are surprised by a first heart attack or heart event and think that maybe it just happened yesterday. There was no progression leading up to that event. So can you talk about how heart disease starts, maybe how many years in advance of some sort of event?
Well, crazy enough, would you believe that heart disease starts when you're in the womb? Actually, heart disease could be said to starting before that. The health of your mother before she gets pregnant will impact her, not her genetics, but her epigenetics and how that goes into you inside of the womb. If you think about how we come from the sperm and the egg, well, the egg that was inside of your mother, that actually was forming when she was inside the womb of her mother. So the grandmother's health impact. So when we talk about the actual start of it, it really is back then. So now if we can change the generations going forward, this is how we can really impact health and wellness down the road. We know from autopsy studies, specifically, it was first really noticed when young men, 18, 19, 20 years old, were coming back from the Korean War, and they were doing autopsies on them, and they found evidence of what is called fatty streaking of the vessels. And then ultimately, again, we're finding earlier and earlier very aggressive coronary artery disease. It is not uncommon to see people with heart attacks in 30s, 40s, and 50s. And I do want to mention a couple things right now that I want to make sure that I get out, to all the people who are listening, because my guess is there's a heavy slant towards women in this channel. I'm just guessing. I'm not trying to be sexist, but I'm just guessing. And oftentimes, again, the people that I see, the husband is dragged into the office by the woman. So again, the woman tends to be much more in tune in general. But I want to mention two things. One is a diagnosis called SCAD, spontaneous coronary artery dissection. That is the number one cause of heart attacks in women under 50. And it typically is stress induced. It's called, again, SCAD, SCAD. And the other is what's called broken heart syndrome, or the official diagnosis is Takotsubo cardiomyopathy. And what that is that is a heart failure that comes after a stressful event, and it typically happens in women ages 40 to 60. Now, again, it's a big stressor, a divorce, a death, something happened at work. And I've seen all these in my patients as well. So I wanted to get that out there, to everyone. But, again, heart disease, it's so multifaceted of what the causes are, but I want people to understand really that stress and that mental health and what we call think well is absolutely critical, and just as important as eat well, live well.
If you enjoyed this short episode, check out our full library on our NAMP YouTube channel, where you can catch up or learn more. Keep in mind that the information on the NAMP podcast is for educational purposes only and should not be considered medical or legal advice. The NAMP is not liable or responsible for any harm, damage, or illness arising from the use of the information contained herein. By listening to the information on this podcast, you agree to defend, indemnify, and hold harmless the NAMP and all agents. Copyright NAMP, all rights reserved.